So hello everyone, I hope I'm audible and visible. Can you all give me a quick thumbs up if my audio video is fine to all of you? Just give me a thumbs up if you all can hear me, if my audio video is all fine, all my dear students. So welcome in the next session of Dermatology with me, Dr. Chesta, your NEET PG educator on the best online platform. And let me just check if I am audible and visible to all of you. Yes, amazing. Now we have another very important session today, that is the must know questions in dermatology. So before starting the today's session, let me very quickly go through some of the important batches or the courses which are about to start. So welcome all of you. We have a session. These are some of the learners who have cleared their exam. So congratulations to both of them. Now please remember this Unlock 20. This offer is extended till February 2nd. This is extended till February 2nd, and that is why I request all of you to please utilize this offer by using the code CHESTA10. So if you use my code CHESTA10, you will get an Unacademy subscription with the extra discount of 20%. Now for the month of February, we have a lot of free class series. The one on 2nd February is the Educator Curated Test Series, and the one on the 4th is Study With Me YouTube series with me. So I request all of you to please follow all these classes starting from 2nd of February. The next we have a plus plus subscription which give you an access to Unacademy live classes from the top educator, and we have iconic subscription which give you an access to both Unacademy and Ladder itself. Now we do have a lot of free live classes or special classes which are available every day on the Unacademy learning app. We have a highly effective question bank of around 25,000 plus question. We have a feature which is known as raise a hand feature, where if you have any doubt you can just raise your hand and ask your doubt. Many new batches, they have already started or they are about to start. For example, we have a Ultra NEET PG, a rapid fast revision batch on 31st, the next batch again on 31st. Then we have a subject wise batch starting on 2nd, and then we have a NEET PG higher ed batch starting on 2nd. We also have the Focus FMG comprehensive batches and NEET PG ultra revision batches starting on 2nd. So I request all of you to kindly utilize this. I request all of you to please use a 2-month subscription of Unacademy using the referral code CHESTA10. You will get 20% discount if you take Unacademy subscription, and the offer is only till 2nd. Now there is a very important information that today at 10 PM we will be conducting an open house session. So you just need to download the Unacademy learning app and connect to that app or connect to the open session which I will be conducting. I will be telling you the strategy to prepare for your upcoming exams. So let us start with the first question of the today's session. Let us begin with the first question of the today's session. We have a lot of interesting questions with us. A 17-year-old girl comes to the physician because of a 1-week history of severe itching in the areas of her genitals. She reports that the itching is most severe at night. She has been sexually active with 3 partners over the past year, and she uses condoms for contraception. Her current sexual partner is experiencing similar symptoms, and pelvic examination shows vulvar excoriations. A photomicrograph of an epilated pubic hair is shown. Which of the following is the most likely causal organism? What is the answer to this question? All of you, I request you to answer this question. It's a long clinical case scenario based question. You can see that there is an image which shows a knit on the hair. There is also a history of itching, and it is secondary to the sexual intercourse. So there is one infection which spread from one person to another person through sexual intercourse. What is the answer? What is the answer of this question? Anyone? What is the answer of this question? What is the answer to this question? Very nice. Please remember the correct answer of this question is Thyrus pubis or pubic louse. Now we have three type of pediculosis: the pediculosis capitis, pediculosis pubis, and pediculosis corporis. In pediculosis of the pubic area, you tend to see the lesions on the pubic hair. In capitis, you tend to see the lesions on the scalp hair, while in corporis, you see the pubic louse on the body hair. Now, thyris pubis is a disease which is sexually transmitted. It is a sexually transmitted disease, and here in this patient, they have clearly mentioned the disease have progressed from one person to another person through the sexual intercourse. So, this is a very classical image of a knit of thyris pubis mite, which you will see on the genitals. Next question. Previously healthy 29-year-old boy comes to the physician because of a 3-day history of low-grade fever, muscle pain. She has 4 male sexual partner over the past year and she uses condoms inconsistently. Now examination shows a diffuse maculopapular rash that includes palm and sole. Which of the following is the most appropriate initial action by the physician in this patient? So what should be done in this patient? What should be done in this patient? What should be done in this patient? Assessment of double-stranded DNA, obtained the bacterial culture, administration of penicillin G. What should be the answer? What should be answered in this individual? Very nice, Chandrakala Farhiya. Please remember, this is a case of secondary syphilis. This is a case of secondary syphilis, and you have to administer penicillin G in these individuals. When you administer benzathine penicillin, why are you administering it? Because the patient have a very characteristic feature of syphilis. When you have a characteristic feature of syphilis, you don't wait for the investigation or serology to be positive. You will start the patient with the therapy. Next question is on your computer screen. A 32-year-old woman with recurrent vesicular genital rash comes to the physician because of a 3-day history of painful pruritic rash. Her only medication is acyclovir. The temperature is 38.1. An examination of the skin shows several reddish purple papules, some of which has a dusky center with a lighter ring around them. Which of the following is the most likely diagnosis? Which of the following is the most likely diagnosis? Fariha, Chandrakala, very nice all of you. Which of the following can be the correct answer here? Very well done all of you. Now here if you look at the question, it says that you have multiple reddish purple papules or macules with dusky center and the lighter ring around them. All of this tells you that you are dealing with what? You are dealing with a target lesion. What is a target lesion? It has 3 zones. There is a central dusky zone. There is a central dusky zone like this. A central dusky zone. Then surrounding this we have a lighter ring. Surrounding this we have a lighter ring. And surrounding that we have a erythematous ring. So dusky center, second zone is edema, and the outer zone is erythema. All this together is a very classical feature of all these are classical feature of erythema multiforme. Now erythema multiforme, the most common causative agent would be what? The most common causative agent is infection followed by drugs. In infection, the most common infection is herpes simplex viral infection followed by mycoplasma. Now please remember, here the question itself says that patient has taken acyclovir. So it is possible that he was diagnosed as a case of HSV infection, and now this patient have developed erythema multiforme or target lesion following the herpes simplex virus infection. Clear? So the correct answer of this question becomes option number 2, that is erythema multiforme. Erythema multiforme. Next question. I am requesting all of you to please join the open house session which will occur at 10 p.m. today. So please join the open house session. I will be conducting that session at 10 p.m. where I will be telling you the strategies to prepare for your NEET PG in 1 month. How to prepare for anyone can tell me the answer here? What is the correct answer here? Anyone? 36-year-old woman comes to the physician because of a painless lesion on the vulva. She does not have any urinary symptoms and she is sexually active with multiple partners. She uses condoms inconsistently and examination shows clusters of 3 to 5 mm raised lesion with a rough texture on the vulva. HIV is negative. Which of the following is the most appropriate step in the management? Please remember the answer of this question becomes option number 2, that is cryotherapy. And why it is cryotherapy? Because the diagnosis here is genital wart. So these multiple rough verrucous lesions which are present on the vulva are the genital warts, and that is HPV 6 and 11 infection. HPV 6 and 11 infection. Moving to the next question which is on your screen. Moving to the next question which is on your screen. What is the correct answer of this question? Anyone? Anybody can tell me the answer? Very well done. So an otherwise healthy 66-year-old man comes to the physician for evaluation of skin over his head, forehead and back of his hand. He has tried applying different type of moisturizer with no improvement. He has worked on a farm all his life and physical examination shows 2 erythematous papules with gritty sensation. This patient's skin lesion increases his risk of developing skin cancers. Characteristic of which of the following skin findings? So in this question they are actually telling you that there is a patient who developed a lesion on the face and that lesion is a pre-malignant condition, can be actinic keratosis, because he worked in farm all his life, so sun exposure is more. Now what is the next very important feature is, after the development of actinic keratosis, if patient do not take care, it can progress into the next very important feature, that is squamous cell carcinoma. And please remember, squamous cell carcinoma known to have keratin pearls in them. Squamous cell carcinoma is known to have squamous pearls in them. Moving to the next question. 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 A 20-year-old male comes to the physician because of a 1 week history of painless ulcer on his penile shaft. The patient is sexually active with multiple partners and does not use barrier protection. Physical examination shows a shallow firm ulcer with smooth base. Which of the following is the most likely diagnosis, or which of the following is the most likely test to confirm the diagnosis here? Anyone? What is the answer here? What is the answer in this question? Anyone can tell me the answer here? A 20-year-old female. So please remember here they have given you two very important points. One point is that you have a painless ulcer. One very important point is you have a painless ulcer. Second important point is you have a firm painless lymph node also. So painless ulcer, painless lymph node which is hard in consistency, very characteristic of syphilis, and the answer to the question becomes option number D. Answer to the question becomes option number D. Next question is on your computer screen. Next question is on your computer screen. Next question is on your computer screen. Please tell me the correct answer of this question, all of you. Please tell me the correct answer. 38-year-old female. 38-year-old female. What is the correct answer? 38-year-old woman comes to the office for evaluation of a skin lesion. It began as a papule on her right arm and has progressively enlarged over the several weeks. The lesion is not pruritic or painful. The patient returned from his trip 5 weeks ago and skin examination findings as shown below. What is the correct answer here? Now please remember, here you can see that there is a lesion which is present on the cheek. You can see that there is a crusting which is seen. Now what happens when there is a crusting? You can see that this crusting followed by a bite of protozoite. It's a very classical feature of cutaneous leishmaniasis. And cutaneous leishmaniasis occurs secondary to the bite of a sand fly. Next question. Okay, before doing this question, I want everyone to do the question, this one. Yes, please try to solve the question. Please try to solve this question. A 28-year-old man comes to the office with bilateral skin lesions over the posterior surface of the elbow. The lesions are itchy at times. Topical moisturizers have reduced the itching, but the lesion have remained. The biopsy of the lesion demonstrates hyperkeratosis, parakeratosis, dilated capillaries in the dermal papilla, and foci of neutrophils in the superficial dermis. Which of the following is the most likely diagnosis here? Which of the following is the most likely diagnosis here? What is the correct answer of this question? Anyone can tell me the answer? Anyone can tell me the answer? A 28-year-old man comes to the office with bilateral skin lesions. The correct answer of this question is Psoriasis. Very, very important. The characteristic answer of this question is psoriasis. 17-year-old boy presented with lesion which is rough in surface and it is present on the lower lip, which has progressively enlarged. He reports no pain on itching. Patient had eczema during the childhood. Physical examination findings are shown in the exhibit. Which of the following is the characteristic histopathological finding in this patient? Acantholysis, multinucleated giant cells, epidermal hyperplasia and cytoplasmic vacuolization. Epidermal hyperplasia and cytoplasmic vacuolization, subcorneal bacterial collection and neutrophilic infiltration, and subepidermal linear complements or deposits and separation. So which of the following is the correct answer here? Which of the following is the correct answer here? Anyone can tell me the answer here? I'm requesting all my dear students to please join the open house session which is scheduled for 10 p.m. today. So after 5 minutes I will be starting the open house session. So I request all of you to just download the Unacademy learning app. You have to update if you already downloaded it, and you have to click on the open house session with Dr.Chesta for the strategy for preparing for the NEET PG exam. So please do that. After the end of the session, go to the Unacademy learning app and join the open house session with me. It's a free session. Anybody can join. You need not be a subscriber of Unacademy. Now here the correct answer is option number 2. You are absolutely right, as this is a case of viral infection. This is a classical image of viral infection. They have coilocyte formation. HPV has coilocyte formation. So this is a viral wart, and coilocyte is nothing but cytoplasmic vacuolization. It is intracellular edema. The next question is here on your screen, and that would be the last question. Then we will be ending the today's session, and I would be waiting for everyone for them to join the open house session. I request all of you to just come and join the open house session. So 73-year-old man presented to dermatology clinic after his family physician finds an ulcerated plaque on the dorsum of the hand, dorsum of the nose. This lesion has changed in size and has bleed on multiple occasions after the patient adopted a sun protective measures. We can see that it is ill defined and the lesion is diagnosed to be a case of squamous cell carcinoma. Patient undergoes standard excision. However, the pathology reports indicate an incomplete excision. Which of the following should be the next best step? Very nice. For these individuals, the next best step is they have to do a microscopic Mohs surgery where we do sequential removal of the tumor. So with this, we are done with today's session, and I thank to all my dear students for attending this live class. I also request you to please join the open house session which I will be conducting in 4 minutes. I will be live in 4 minutes. Also subscribe the YouTube channel, that is Let's Crack NEET PG. We have our Telegram group with the same name, Let's Crack NEET PG. So please join it to get all the notification. Please use my referral code CHESTA10 so that you can get the 20% discount on any of the Unacademy Plus subscription. Please remember, this offer is only till 2nd of February. So please avail it now, and don't forget to give me a thumbs up, or don't forget to press the bell icon so that you get all the notification of my classes. And requesting all of you to please join my open house session on the Unacademy learning.